Most of the clients that come to see me have already done this. They've gone and they've searched and they've watched TikTok, and they've browsed all through YouTube, and they still don't have a solution. And the reason for this is because there's so much information out there, and your acne is so individual to you. So sometimes you just need a professional eye. Hello souls, my name is Kathleen and I'm the owner and lead therapist here at Soul Awaken Skin Therapies, a clinic based here in Glenelg, South Australia. And here in my clinic, I specialize in treating the skin condition acne. So on this channel, I talk all about this skin condition, and it really is a place where I get to share all the knowledge that I have, because I know so many of you are suffering from this skin condition and you are just searching for answers. I know that as a clinician, when I go into the internet just to have a little snoop around to see what information is out there, I tend to find a lot of either incorrect advice or just my questions that I know my clients have simply not answered. So that's what this channel is all about. So if you would like to learn more about acne, definitely consider subscribing and clicking that little bell icon. So in today's video, I'm really excited to be talking about teenage acne. I love my teen clients. They inspire me so much because they come into the clinic and they're just like little sponges. They really do take on all the information that I share with them. And just to see their dedication and just level of knowledge for such a young person, it really does inspire me. I'm really excited to be sharing with you all my tips when it comes to teenage acne and how this kind of is different to adult acne, which is what I usually or predominantly treat here in my clinic. However, teenage acne is definitely something I love treating. Before we get into today's video, I would like to say hello and welcome back to all returning clients, followers and subscribers. It's so nice to have you here. Did you know that you can go ahead and follow me on both Instagram and Facebook? It's a place where I like to spontaneously jump on and go live to talk about skin topics such as acne and just other different types of skin tips. I would love to see what you have to say so I can answer your questions and help you with the things you're needing, and you may even inspire a new video topic. So definitely don't be shy, comment below. So I'm going to do a really brief introduction into teenage acne, just so you can get a little bit of an understanding. So what causes it? Well, the thing is, I will put it down to hormones because generally that is the reason why it happened in the first place, but there is a few other nuances to this. So essentially, you are changing from a child into a teenager, and throughout this change from what we call puberty, you will find that the skin and your hormones change quite a bit. So the way your hormones are expressed will change your skin. So what we tend to see is that in a teenager, we'll have an abundance of oil come through. And oil is a fantastic thing because it's actually going to play a huge role in your skin barrier function. So it's going to make your skin healthy and well functioning. It's there to protect you at the end of the day. However, during your teenage years, because you are having an excess of this oil mixed with every other lifestyle factor involved, we tend to find that this is a little bit of a recipe for disaster, and it does tend to create acne in a lot of younger teenagers. So throughout this puberty time as well, we're starting to see changes in body hair. So this is something that's not really spoken about, but what happens is your vellus hairs, depending on whether you're a girl or a boy, and different areas to do with your body and also to do with your genetics, is you'll find your vellus hairs, which are your baby hairs, will sometimes turn into terminal hairs. And a terminal hair is those thicker, blacker hairs. And with that stronger, thicker hair that is being produced, this is also an aggravating factor for acne, because essentially an acne, pimple, pustule, or whatever you want to call them, a breakout essentially forms within the hair follicle, the pilosebaceous unit. And I'm going to pop that just here so you can have a look. You'll see how the hair follicle attaches to, well, the sebaceous gland actually attaches to the hair follicle, and throughout that thin little hair follicle, so the hair shaft, this is where a breakout occurs. So you can imagine there's excess oil coming up because of those hormones, and now you're getting thicker hairs. It really does result in breakouts. This is why it's so common during your teenage years. So as you can imagine, mixing all of these changes in your skin, so the excess oil and the hair growth, mixed with all the different lifestyle factors that come into play when you are growing from a child into a teenager, there are so many things that impact it. So I want to be exploring that a little bit further. But as you will probably know, if you're a teenager, you can definitely attest to this. I can, because I found that my teenage years were quite a stressful time, because you're really finding yourself. You're going out there and you're experiencing things for the first time, and a lot of things can be very embarrassing, especially as a female, when we're just not sure of who we are. So stress plays a huge role in acne, and I will talk about this in a separate video because it is such an important topic to talk on. But stress tends to heighten during these teenage years because we're having a lot of peer pressure and school, extracurricular activities, parents, everything. And as a teenager, we tend to eat a lot more nastier foods. So your takeaway and all of these things like sugary treats. At the end of the day, it's okay to eat these foods. However, when you're a teenager, and again, I can attest to this, it's really easy to eat a lot of these foods because your body is so forgiving, because your body really is at its optimum, and you're able to have these foods with little to no repercussions. However, they do have an effect and they play a role in acne. And lastly, we have the introduction of makeup and hair products, because prior to this, when you were a child, you probably weren't using makeup or hair products. That was something your parents took care of, but now you're a teenager, you're doing it for yourself, and you're starting to wear makeup, and you're starting to experiment with skincare or using hair care products. And the thing is, those products are all good and well, but they can affect your acne. So I'm going to explore that a little bit more in detail. So first of all, how do you treat teenage acne? I would like to say that it is all good and well to watch videos on YouTube to get lots of tips and education and advice. And if you can implement that and you're starting to see positive results, amazing. I'm so happy for you. But I will just say this right now. Most of the clients that come to see me have already done this. They've gone and they've searched and they've watched TikTok, they've browsed all through YouTube, and they still don't have a solution. And the reason for this is because there's so much information out there, and your acne is so individual to you. So sometimes you just need a professional eye, so you know if it's non-inflammatory or inflammatory acne, what grade is it needing the intervention of pharmaceutical medical practices, or are you able to treat it through a holistic skin therapist or an esthetician if you're in America? The thing is, a professional has treated acne before, so they've seen it time and time again, and they know what to expect. And as a holistic skin therapist myself, I have developed my own process, and I take my clients through 3 steps. First of all, we go through the repair phase. So that involves repairing the skin barrier and making it strong and as healthy as possible. The second phase, which is the clearing phase, and that's when we're actually starting to really reduce the breakouts and the severity and the frequency of them. The third phase, I call it the refining phase, where the breakouts are really slowed down or stopped altogether. We're actually starting to do a lot of that repair work. So we're helping to treat acne scars, refine the skin even more to make sure it's really soft and smooth, and treating any other little bits and pieces that are left over from the acne. So as you can see, every professional has their own process, and they can actually guide you down a journey and help to coach you along the way, because dealing with acne, it's so frustrating. It really, really is, because you just have this new pimple pop up and you're like, what is it from? But that's what a professional is there to do. So definitely do not hesitate. If it is quite inflamed, you're getting a lot of pimples and there is quite a lot, please go see your doctor and get a dermatologist referral. That is your best solution, just so you know what grade that you are affected by. But if it is a little bit non-inflammatory, so it's just blackheads and a couple of pimples here and there, you might be fine to just see your skin therapist or esthetician who can start treating you from the get-go. So once you've sought the help of a professional, or at least you've got a little bit of guidance, this is when you want to start treating the condition. Now, it's not going to be the same from one person to the other. So what I'm going to be doing now is talking to you about a whole heap of tips very specific to teen acne. So I have a very, very long list, so definitely take notes and come back to this video and just make sure that you've implemented all of these tips, especially if they are relevant to you, because it's not just one thing that you do that will treat your acne. It is the accumulation of habits and lifestyle changes that will actually get you to your goal. So here is my list. You want to make sure that you're cleansing your skin at nighttime twice. It's called double cleansing, and if you haven't heard of it before, it basically just means you cleanse your skin once to remove the dirt, the makeup, the grime, the pollution, everything that's on your skin. And then the second cleanse, that is really to actually cleanse your skin. Quite often, even if you're not wearing makeup, one cleanse just isn't enough. So cleanse twice at nighttime using a non-stripping cleanser, especially if you have acne, because there are so many different acne products out on the market at your pharmacy or grocery shop where they're just not suitable for acne and they're very stripping. And the way to tell if you have a stripping cleanser is that it feels very dry on your skin afterwards. So you want to find something that is pretty pH neutral. A lot of influencers will recommend the CeraVe gentle cleanser. Here in Australia, we find it very difficult to get this product in because it's usually sold out. And to be honest, I don't think it's that revolutionary, but you could try any other type of gentle foaming based cleanser. So you could go for Cetaphil, QV. There are so many options out there. I personally love and adore Dermavisuals, and that's what I recommend for my clients that come to see me in the clinic. So when it comes to cleansing, you also want to make sure that once you've started to exercise or you're at school and you've just completed your PE lesson, that you're cleansing your skin as well. I know that this is a very annoying thing to do, but I want to educate you about sweat and how that can aggravate acne. So you've just sweated on your skin and potentially you are wearing makeup as well, so foundation, and you started to sweat, and what happens is sweat crystallizes on the skin. It's like little salt particles, and they actually start to clog and occlude the skin in a way that can lead to more breakouts. So if you can, try to bring a cleanser to school or even a very, very gentle face wipe. I'm not a fan of face wipes because they do tend to be more problematic than not, but you need to find something to cleanse your skin when you're at school after your PE lesson, and try to, if you can, not wear makeup before PE and apply the makeup after. I know that might be a little bit difficult, but it actually does play a big role. So that means whenever you have sweat, you really want to make sure you're removing it from your skin. So if you've had an exercise class or some sort of sport that you're doing after school, you really want to make sure that as soon as you get home, you're doing your nighttime routine with that gentle double cleansing method. When it comes to your skincare, you also want to incorporate exfoliating, but in a very gentle way. You don't want to over exfoliate, and you don't want to use anything too harsh on your skin. That is something that you really want to find a balance with, and I can't tell you exactly what is suitable for your skin, but generally speaking, about 1 time per week is suffice. My personal recommendation for treating acne with an exfoliant is to be using something like an enzyme or a BHA or a combination of the both. So a BHA is a beta hydroxy acid, so salicylic acid is the best solution for this because it actually gets down into that little hair follicle. Because it's a lipid loving molecule, it actually gets attracted to that sebaceous gland, and it goes all the way down, eating away the particles, and starts to unblock that hair follicle, creating an antimicrobial and anti-inflammatory effects on the way down. So they're great solutions for exfoliating when you have acne. You may also want to start utilizing clay masks. Trust me, they are going to be your best friend as long as you pick the right clay mask. So you want to avoid fragrances and all those nasty ingredients and go for something as natural as possible. But when you apply this clay mask, don't put it on and then leave it for hours. I've been there, I've done that in the past. You know, when you apply a clay mask and it is so drying and it's like your face just feels like like that, and everything is cracking, you're like, oh, my face is so tight. You don't want to get to that stage, because that's actually pulling water and oil from your skin too much, in fact, and that's actually going to disturb your skin barrier even more. So what you want to do is put a clay mask on maybe 2 to 3 times a week, remembering that a clay mask will slightly exfoliate your skin. You want it to dry if you have excess oil on your skin, but not for, over 5 minutes. 5 to 10 minutes max when it's dry, and then you want to wash it off and then continue straight away with your skincare routine, which should have some sort of salicylic acid. You want to have ingredients like vitamin A, vitamin B3. So vitamin A could be retinol or retinol palmitate. There are so many different forms of vitamin A available on the market. You also want to have the salicylic acid, which I mentioned before, vitamin B3, so niacinamide, and also your D-panthenol is a great ingredient as well. Zinc is a fantastic topical ingredient, as well as azelaic acid. That's a great ingredient. And I incorporate all of these into the skincare that I prescribe for my clients. You might also want to use green tea, other anti-inflammatory ingredients, or skin barrier healing ingredients as well. It just depends on your particular case. You may also want to consider taking supplements and also going to your doctor to check for any deficiencies in your body. You never know, you might have an iron deficiency, you might have another type of nutrient deficiency like B12 or zinc, because when there's nutrient deficiencies, this is going to compromise your health and just things can't heal in the best way possible. And what we tend to find, especially in the research, is that there is definitely a correlation between inflammatory skin conditions and a zinc deficiency. So it is actually worth seeking the advice of your doctor first. Definitely speak to your doctor before taking supplements. I like zinc picolinate. Please do your own research on that. But I will also tend to recommend omegas. Now, omegas, or your omega-3s, essential fatty acids, whichever one you want to call them, your omega-3s will actually reduce inflammation in your body, and they'll actually start to thin out the oil that your skin is producing, because I spoke about it in my last video, Heal Your Acne, Fix These 3 things, which I'll link up just here. But essentially, I spoke about how your oil quality becomes quite clogged and it becomes like cottage cheese. So what the omega-3s do, they actually start to thin that out, which is a really good thing. So I highly suggest looking into those omega-3s and making sure that it is, of course, right for you. When it comes to your makeup, you want to make sure that you're using non-comedogenic makeup. So that basically means that the makeup that you're applying to your skin isn't going to break you out, or at least it has a very low chance of breaking you out. So what I tend to recommend for my clients is a mineral makeup line. There are so many makeup lines out there, and when it comes to foundation, my absolute favorite is the Dermavisuals customized foundation, because I can literally make it to suit your exact skin color. So I literally, in front of you, add red, black, yellow mixed with white to make your exact skin tone. It's an amazing foundation and it is acne safe. That's my first port of call when treating acne. However, if you can't come into the clinic, there are so many others out there. I personally really like Jane Iredale. I think that's a great mineral makeup line, but there are so many out there. So please make sure that the makeup you're using is non-comedogenic and not actually creating more acne on your skin. I see this a lot in the clinic. You also want to make sure that you're actually paying attention to the food that you eat. Now, I said it before at the start, because when you're a teenager, you tend to be a little bit unforgiving with the food that you eat, and that's totally fine. But there are certain food groups that do exacerbate and aggravate acne through the IGF-1 pathway, so insulin growth-like factor. So basically those foods are dairy. You knew I was going to say it, didn't you? Dairy does have an impact. So before cutting out dairy altogether, speak to your doctor to get the correct advice that's right for you. But essentially, dairy is something you want to consider minimizing. Sugar. Sugar is the devil. Sugar can really cause havoc in your body. It increases your inflammation levels. It really disrupts your immune system. And as you guessed it, it does trigger the IGF-1 pathway. So it's going to cause more acne in your skin. Just remember that sugar is not only found in sugary treats, it's actually found, or at least I should say converted in your body to sugar when you are eating refined carbohydrates such as white pasta, white rice, and white bread. When you eat those foods, it's being converted in your body to sugar. So again, triggering that IGF-1 pathway and creating more breakouts. You also want to consider reducing and avoiding any processed foods, takeaway foods, highly saturated fats, basically anything that isn't a whole food. So a whole food is something in its real form. So an apple or a carrot or a banana, that is a whole food. Even rice is a whole food. You just really want to Prevent eating too much of those packet foods and takeaway items, because again, they can also increase your likelihood of getting a breakout. And probably my most important tip that I hope you take very, very seriously is to absolutely consider the effects of stress and your skin. And I don't say this lightly. Stress absolutely plays a role not only in your skin health and creating more breakouts. So when you're chronically stressed and you have a lot of stress in your life, it'll cause more breakouts. But what it also does, it increases inflammation in your body. And remembering before, acne is an inflammatory skin disorder. So you really want to make sure that you're reducing inflammation in your body and managing your stress. So by this, my first tip is to actually go seek someone who can help you with your mental health. You don't need to be depressed or have anxiety to get help from a mental health practitioner, a counselor, a psychologist, whoever you feel comfortable with. It could even be a family member. As long as you're seeking help for your mental health and reducing stress levels and basically creating habits in your life that will help to manage stress, so you know that when you have a stressful situation come up, you have all these tools in your toolkit to rely on when you're feeling very, very stressed. And that's what a counselor or a psychologist or a mental health practitioner can help you with. They'll really teach you the skills of coping, becoming resilient and powerful, and they'll also help you if you have a mental illness as well. So really consider that, because I know all too well. I have had so many clients come to me, they're crying because there's so much emotions around their acne. It really does bring you down. So please seek the help of a mental health practitioner and you will not regret it, I promise you. A big no-brainer is to not touch your skin. Do not pick it. I don't even need to elaborate. Please don't pick your skin. It'll increase your risk for scarring and it will just make the whole issue even worse. So just don't pick your skin. Some other practical tips is to make sure you're using different face washes or cleansing tools every single day. The most simple and effective cleansing tool is a simple face washer. So use a new face washer every single day. Even if it dries out between uses, you don't want to use it again because it is dirty, bacteria lives there, mold could potentially be growing. So just invest in about 14 different cloths. I know it's a bit extravagant, but most department stores will have face cloths or face washers. They're just a small square cloth for about $1 or $2 for a couple of them. So invest in a whole heap and use a new one every single day. You also want to make sure that you're changing your pillowcase quite often. And when there is active acne, I do recommend changing it about every second day. So every second night, you want to flip your pillowcase. So you can get about 2 nights out of one pillowcase. At minimum, you want to be changing your pillowcase every 7 days. You also want to make sure you're washing your makeup brushes, yes, after every single use. I'm sorry to be the bearer of bad news. It's difficult and it's annoying, but you gotta wash your makeup brushes because bacteria lives on your skin. You're transferring it to your makeup brush, you're transferring it to your makeup, to your face. Here we go again. And then if you are sleeping in your makeup and then you're sleeping on your pillow, the next day you go to sleep on your pillow with that dirty makeup. You can just imagine it is just this cycle and it is feeding the acne even more. So please wash those makeup brushes. And in terms of your skincare, you just want to make sure that you're using low irritating skincare and skincare that is customized to your skin with all of those ingredients that I mentioned at the start. So as you probably realize, there's so much information when it comes to treating acne that it really does take the guidance of a skilled and specialized practitioner to help you with your skin. So thank you so much for being here with me today. I've really enjoyed my time spent with you, and I hope that you've learned something new and you've written a lot of notes on all the little tips I have to share with you. Honestly, there are so many more, and depending on your unique set of circumstances, the tips that I suggest for you may be different. These were just general tips that I shared today. So before you go, don't forget to subscribe, tick the little bell icon so you don't miss out on any of my future videos, and also definitely comment below to let me know what you liked the most. Oh, and the like button, don't forget that too. Wishing you a beautiful day, souls, and I'll see you here next week. Bye.